Okay, so now we're going to move on to the leg portion. So the leg portion is going to be from the knee to the ankle, right? So remember we have, here's the knee. And then there's our ankle. So we're only going to look at the muscles in this specific region. And we're going to go through, again, the ones that we can find on the model. I'm going to fill out my synergist chart. Excuse me. I'm going to fill out my synergist chart, but I'm going to only label the stuff that you need to know for your lab practical. That doesn't mean you don't need to know it for your lecture exam, okay? So our anterior quadrant is again going to be innervated kind of bifemoral, but not exactly bifemoral. It's actually going to be that the femoral nerve doesn't go past the knee, but a little piece of the femoral nerve does go past the knee. So what that means is the muscles that are on the anterior side are going to be L4, their segment. L4 is part of the femoral nerve. And then it's going to L5. L5 is part of the fibular nerve. So we're going to think about this as being fibular nerve in terms of its innervation with a little piece of femoral that's part of it, okay? So like on a practical, write fibular as your answer because it is the fibular nerve that's innervating it. There's just a little piece of the femoral nerve that's going along with it. So I'm gonna, I was like, should I restart my numbers? No, let's start with number 22. Why not? Okay. So we're gonna see that, I'm sorry I didn't take a very good picture of this. It's really hard to take a front picture of the model in terms of the leg part. So we're gonna see that there's a muscle right here that's gonna come down like that. Whoa, I know my lines are just not good at all. You'd probably be surprised that this is an artist's pad that I use in order to draw. Maybe it's overly sensitive or I just don't know how to use it right. I don't know. So that's going to be number 22, right? I got my numbers right, number 22. 22 is tibialis anterior. So this is the only muscle in the anterior quadrant of the leg. And I didn't do the actions or the attachments just yet, but at least you know where it is, okay? So it's the fibular nerve in terms of its innervation. Remember, you want to know the segments L4 to L5. The action here is dorsiflexion. So you're dorsiflexing the foot. What that means is you point the toes upwards in dorsiflexion, right there. It does do a little bit of eversion. Let's just keep it simple and we'll do dorsiflexion, okay? So its attachments, I mean, sort of duh, it's attached to the tibia. And I know I shouldn't say that, but its name is tibialis anterior. Tibialis anterior because it's in front of the tibia. So it's actually coming up to the anterior portion of the tibia as its attachment point. And because it's doing dorsiflexion, pointing the toes, it has to go past the ankle joint to move that ankle joint. So it's going to attach here either at the tarsals or the metatarsals, something like that. That's why, you should check the PowerPoint for more explicit details, but then you also need to just kind of think about, well, if you know what those bones are in the foot on a test that has multiple choice, you want to pick the best answer. It's either the answer that's tarsals or the answer that's metatarsals. And hopefully there's not those same two things on the test as a possible answer, because in some cases it actually attaches it both the tarsals and the metatarsals. So it wouldn't be that specifically as two different answers. Okay. So our medial compartment here, our medial quadrant here is on the other side of the leg. I mean, because this is lateral side. So the medial side, one on the leg, it's not really medial, it's more deep. So you don't have to know that muscle on the model, but you do need to know this for the lecture exam. You need to understand that, again, this one muscle has L4 from the obturator nerve, And it's going to have L5 from the tibial nerve. And we're going to call this tibial nerve as its innervation because obturator doesn't go past the knee. Okay. See my Christmas colors again, right? And then I see my blue and my orange together, right? That was the whole idea of stuff staying on the right path. The action here of this muscle is plantar flexion. Anything that's on the back side is plantar flexion. And I know you're thinking, but this is medial. The leg really only has a front and a back. It does have a lateral side as well, but it's mostly considered to be on the back side. So this is going to help us do plantar flexion. And you don't have to put foot, but you can. It helps us plantar flex the foot, which basically means I'm going to pull my foot backwards, okay? Pulling your foot backwards, like putting your foot on the gas, putting your foot on the brake. That's plantar flexion. The attachments for our tibialis posterior, which is what I should write here. Whoops. Because I just remembered I can't actually label this one. So the attachments, again, it's attaching to the tibia, and I believe this one was like the interosseous membrane, actually, but we're just going to say the tibia. And then it has to come all the way under the foot. So again, either at the tarsals or the metatarsals to pull those backwards. Okay, so we can't really see that one on the model. So don't worry about that on the model. You might be able to see it here on the model because that's the medial side, but I don't want you guys to have to try to figure out what those muscles are. We're not going to go deeper than the soleus muscle, and I'll show you where the soleus muscle is. And then I'm just going to move that a little bit so you can see how I say lateral right there. All right, so the lateral quadrant is going to be opposite, technically it's opposite of the medial quadrant, right? And these should be antagonistic muscles. But part of the problem here is that, tibialis posterior is actually backwards. It's posterior, so it's not exactly a synergist. What we're going to see is that if we go back here, well, these are actually synergistic muscles, right? To plantar flex, dorsiflex, I'm sorry, those are antagonistic muscles. Wow, it's really late. It's probably 6:30. It's not that late. But those are antagonistic muscles, okay? What we're going to see is on the lateral side. So the lateral side is going to include a couple of muscles, and those muscles also help us do plantar flexion. They also help us extend the digits a little bit. And then one of those muscles, or a couple of those muscles, help us do eversion. Everting the foot would be like pulling the sole out that way. So you're everting the foot, you're pulling it out towards the lateral side, away from the midline. Okay. So in this case, the nerve is going to be the fibular nerve. Remember, fibular is always going lateral. So it's going to the glutes area, and then it's going to the lateral side of the leg. The attachments for these muscles vary slightly, but since they're on the lateral side, we want to remember the fibula. Because remember, the fibula is the laterally positioned bone. And then they're also coming down here, and they're actually wrapping, a lot of them are wrapping under the foot or going to the digits. So this is either going to be the metatarsals or the phalanges. But I think most of it is attaching at the metatarsals to move the sole of the foot, okay? Just double check. Sometimes I write things slightly different in lecture. Sometimes I write them slightly different here. But you should double check the PowerPoint slides too for more detailed information. Okay, so we had number 22. So let's start with number 23. So if we go back to our picture here, this is 22. That is tibialis anterior. Then we're going to see this next muscle that's lateral to it right there. This is 23. That's extensor digitorum longus. Extensor digitorum longus, you should see how the tendons come into the digits right there. And then the most laterally situated one, you see there's one long muscle right there. This is 24. That's fibularis longus. And there's a smaller muscle right here underneath it, and this is 25. This is going to be fibularis brevis. So these muscles are going to be 22 through 25, okay? So extensor digitorum longus, fibularis brevis. And those, yeah, just those ones. I was like, wait, 22. No, hold on. 22 is tibialis anterior. I know you're all thinking, no, you did that wrong. If you thought that, good. 23 to 25 in that case. Okay, so then we're going to do the posterior muscles here. And I'm going to use my maroon again. So posteriorly, we can see that there's this muscle and that muscle posterior. So we see this muscle and that muscle that's running posterior. There are a couple of additional posterior muscles that I talked about in lecture. Make sure you also have those on your chart, but I'm just going to label the ones that are on the model that you can see. Okay, so this superficial muscle here, which is going to be 26, and then you can see that comes like that, just like that, is 26. So 26 is gastrocnemius or gastrocnemius, if you want to spell it a little bit better. Gastrocnemius, you're going to see how it comes down to this really big calcaneal tendon right there. And then the muscle that is deep to that, that's you can see on the lateral and the medial side. So that muscle right there, 27, that muscle 27, that's soleus. Okay, so we're going to say 26 to 27, which is gastrocnemius and soleus. And here we can put plantaris. Plantaris is almost impossible for you guys to find on this model. It's not impossible, but it's very difficult. So don't worry so much about that one. And we have popliteal. Again, popliteal is a deeper muscle. Don't worry so much about that. We're not going to go past soleus, okay? And then let's think about this in terms of actions. Well, let's put our nerve. So our nerve is tibial. And I forgot my segments on here. Should be L5, S1, S2. So then we're going to do tibial, right? Tibial is L5, S1, S2, just like that. The action for these muscles is, again, plantar flex. So you're going to see some weird antagonistic thing happening where basically our anterior side does dorsiflexion. It's the only muscle that does dorsiflexion. And then the antagonistic muscles are all the muscles that are both medial and lateral, medial, posterior, and lateral quadrants, because they all do plantar flex. So you actually will do calf raises a little bit easier than you will pointing your toes up, because there's only one muscle that points your toes up, okay? These muscles are all going to do they're going to attach mostly at the tibia and the fibula in the proximal sense, but gastrocnemius actually comes up here towards the femur because it does a little bit of knee flexion at the same time. So we can say tibia, most of them are at the tibia / fibula, basically meaning they kind of attach in roughly similar places. Either the tibia or the fibula, okay? And then the really important one is, you see how it's coming to the calcaneus right there via the calcaneal tendon. That's the thing that you want to see as a common attachment point for not all these muscles, but like gastrocnemius, soleus, and plantaris all have that part of the tendon, and popliteal is a little bit too high up for that. Okay, So hopefully this helped you with labeling some of your muscle models too. If you didn't get a chance to go to Open Lab and see them again, you have a couple pictures you can label yourself. And then you also put the colors of the innervation on the models. You do need to know that for your lab practical. So I hope that kind of helped you with looking at where colors are, because that can be very, very beneficial. If you remember, oh, this was blue was femoral. If you don't remember what blue was, that'll be a bigger problem or a problem. Okay. So for actions and attachments, think about that for a lecture-based exam, not for a practical. Okay. I hope this helped you, and I'll try to do an arm and like some of the other lectures that are missing because I've been a little bit busy with other things in the next couple of days, so you can have them to study for your practical exam shortly. Unless you're watching this in the future, then it might not matter.